You go ahead.
Okay, I'm going to be talking about the medial compartment of the thigh, which is basically the adductor, adductor. And there are four muscles, which is the abductor longus in here. First, I'm just going to name them, then I will talk in details. Abductor longus, here we can see abductor brevis. We cannot fully see it because of the gracilis, but still, in here, you can see it. And the adductor magnus.
Okay, so the most superficial is adductor longus. Beneath that is brevis. Beneath brevis is magnus. Okay, from superficial to deep.
Yes.
Okay.
About the longus, it originates from the anterior pubis, and it inserts at the medial lip of the linea aspera. And mostly the adductor compartment, basically, as the name says, it adducts. So this is the abduction, this is the adduction. It flexes the thigh at the hip joint, and it laterally rotates the thigh. And obturator nerve is the nerve that innervates the muscles. We have an exception, we will get there. Brevis is abductor brevis. It's originated from the outer surface of the inferior ramus of the pubis, basically inferior ramus. And insertion is the upper part of the linea aspera. Again, same actions as the longus, which is the adduction, flexion, and lateral rotation. Again, same nerve, obturator nerve. Then we have the adductor magnus. You can see it here. It has two parts. Also, it's located posterior to the other muscles of the medial part, and it has the adductor compartment and the hamstring compartment. The adductor compartment originates from the inferior ramus of the pubis and the ischial ramus of the ischium, and inserts again at the linea aspera of the femur. And the hamstring part, it originates from the ischial tuberosity and inserts at the tubercle and medial supracondylar line of the tibia.
Femur.
Sorry, femur. Actions, both of them adduct the thigh. The adductor part, it also flexes the thigh, and the hamstring part, it extends the thigh. It also has dual innervation. The adductor part is innervated by the obturator nerve, and the hamstring part is innervated by the tibial division of the femoral sciatic nerve.
Tibial division of the sciatic nerve.
Yes.
Or you can just say tibial nerve.
Yes. Also, did they explain the hiatus of the adductor hiatus?
Okay, you guys want to explain the adductor canal, or she should explain the adductor canal?
Go ahead if you want.
Yeah, let's
Yes, I
go
don't
ahead.
mind.
I don't mind. Yeah, go
Okay.
ahead.
As we have the hamstring part, we have the magnus, adductor magnus. Adductor magnus, it has two parts, and when those two parts insert, they form a canal and an opening. I think the three names were mentioned, thankfully. And it forms a pathway, and which the femoral artery and vein passes through it to go. I don't think we can see it.
So this, look at this over here. This is the canal.
Okay. Okay, here is the canal, and the femoral artery and nerve vein passes through it to go to the posterior thigh, to the popliteal fossa, right?
Right, this is the canal here, okay?
Yes.
It goes through and then comes out through the hiatus. So this is the hiatus over here. That hiatus is located in the adductor magnus, okay? And it goes to the popliteal fossa. So through this canal we have femoral artery, femoral vein, saphenous nerve,
and vastus
nerve to vastus medialis.
Yes.
But which structures pass through the hiatus back to the popliteal fossa, which don't?
So basically the femoral vein and artery passes through it, the saphenous nerve does not pass, it superficially goes. And the nerve to the vastus medialis, it goes inside the canal, but it does not leave the canal. It just stays there and innervates the vastus medialis.
So basically, the nerve to vastus medialis goes through it, and then comes out, and it supplies the vastus medialis, okay? It doesn't have to go through the hiatus. Vastus medialis is over here. And the other is the saphenous nerve goes through it, and then comes out and becomes superficial, just beneath the skin, and supplies the medial aspect of the leg, okay, and also medial aspect of the foot. All right, that's a saphenous nerve. Okay, good.
Okay, and then we have this guy in here. It's the gracilis, and it's the weakest muscle of the medial compartment. It originates from the inferior ramus of the pubis, and it inserts, as you can see here, which is the upper medial aspect of the tibia, and it's a part of the pes interinus. Again, the action is adducts the thigh at the hip joint and flexes the leg because it goes to the tibia. And again, obturator nerve innervates it. It also, basically, if we do not have this muscle in our lower limb, no functions will be distracted. That's why it can be used as the muscle for the transplant. So basically, if you have any face injury or any injury that you need a muscle for it, this muscle could be used to be transplanted in there. Again, as we talked about pes interinus, you can see here, pes interinus or the goose foot. It comes from the three muscles, from the sartorius, from the gracilis, and from the semitendinosus. That's about it, I guess.
Okay, quick question.
I ask questions? Okay. I just talked about it, but what muscle is used for the transplants? Okay. And what structures passes through the canal, the adductor canal?
Completely.
I didn't
What
finish my
structure
question.
passes through the canal and through the hiatus? So hiatus is the area where it basically enters the popliteal fossa. That's the hiatus. So the question would be, what structures passes through the hiatus? It passes through the canal and to the hiatus. From the hiatus, you would enter the fossa, the popliteal fossa. So which two structures? Right, femoral artery and femoral vein. Which structures enters through the canal? Four structures. First, arterial vein, which is femoral artery, femoral vein, saphenous nerve, and nerve to vastus medialis. All right? Okay, thank you very much.